Welcome to Passive Curiosity in an AI world, where we explore tomorrow's careers through the lens of AI. This podcast is a resource for students, parents, and college advisors who want to understand how AI is quietly reshaping real careers long before students graduate. The goal is to help us build adaptable, meaningful careers and make informed educational choices as the world changes. Here's a weird thought. What if AI is actually the thing that brings more humanity back into medicine? Dr. Chris Longhurst is helping make that possible in hospitals that run more like NASA Mission Control. Let's get curious. Today, we're in our AI in Healthcare mini-series, and we're talking with Dr. Longhurst, a pediatrician, a national leader in digital health, and the new Chief Executive Officer of Seattle Children's Hospital. Before this, he was a founder and executive director of the Joanne and Irwin Jacobs Center for Health Innovation at UC San Diego Health. He has spent years helping children's hospitals and health systems use technology and AI, things like mission control centers and advanced data tools, to make care safer, faster, and more equitable for kids and families. We are so happy to have Dr. Longhurst joining us today. Let's start with what your work looks like right now. If your teenage self could shadow you, how would you explain your job and what a normal week in your life looks like?
That's a great question. So, for my teenage self, the daily basis has to do with leading the hospital and health system and finding more efficient ways to use technology to better care for patients.
Your bio mentions that you added medical informatics during medical school instead of just following a straight clinical path. Can you tell us a little about what medical informatics is and what led you to combine these two roles?
Sure. Medical informatics is the intersection of information technology and healthcare delivery. And it was something that I found during medical school when I was looking for a way to marry my interest in computers with my interest in healthcare and medicine. So I was very fortunate that my medical school, UC Davis, had just started a graduate program in healthcare informatics. So I was able to take time off between my third and fourth year of medical school to get the master's degree. Ironically, my thesis work was actually using AI to help diagnose innocent and pathologic heart murmurs in children.
Oh, that's fascinating. Actually, now I would love to focus on the AI side of all this. I know at UC San Diego Health, you helped design a kind of mission control center that uses AI to improve patient access and safety, almost like air traffic control for a hospital. For our listeners, can you paint a picture of that space? Who is in the room? What is on the screens? And what decisions the AI is actually helping people make?
Great question. So, first of all, picture sort of the NASA command center with screens full of information about spacecraft or the space to the moon, something like that. Every day in the hospital, we're generating tons of data about all the patients moving through the hospital, about all the employees moving through the hospital, visitors, and it's our job to figure out how to most efficiently move everybody through and provide the best hope, care, and cures. And so we've been able to leverage all of that data with an AI layer on top to help things like our clinicians diagnose sepsis earlier than they would otherwise, or to make better decisions on how to place patients and how to move patients through the system in the most efficient way. So this is a project underway, not a done project, but we're really excited about the possibilities.
That's wonderful. Beyond the control center, is there any other places that you personally experience AI in your day to day work? What are a couple ways that it is quietly changing how you and your teams work, even if patients might not always see it?
Sure. So on the one hand, it might be behind the scenes helping us draft emails and respond to emails, helping us to evaluate financial statements and contracts and all sorts of things like that in the background. On the flip side, the patients may actually see it. For example, when we're responding to patient messages, we can use AI to help draft those responses. When we do that, we're very transparent with our patients about the fact that we're using AI to help.
Oh, that's wonderful. Let's stick back and look at maybe the bigger picture of your field. You've been using medicine, or you've been in medicine long enough now to see it before and after this wave of digital tools. From your own experience, what are one or two of the biggest ways that AI has changed the reality of working in healthcare? Have you seen any types of worker roles fade out or any new roles or responsibilities appear because of the AI?
Sure. Well, we've been talking about AI as if it's a sort of recent thing. And while large language models, appeared in a useful way in 2022, the reality is that we've been digitizing the healthcare experience for 2 decades now, right? So as you mentioned, my career started way back in 2003 and 4 as I was finishing residency, and I joined a large electronic health record implementation project. That was over 20 years ago. And the reason that we were digitizing orders from physicians and nursing documentation and physician notes was not only to improve legibility, but to reduce errors and reduce harm that was preventable. So, for example, wrong dose errors with missing decimal points and things that can hurt patients, including children, we want to eliminate those. And we knew that digitizing the electronic health record was one way to do that. So here we are 25 years later. We've been working on this for a long time, and we've improved some things and we've worsened a lot of others. So the reality is that doctors spend more time in front of keyboards, nurses spend more time in front of keyboards than they used to. Now, we don't know for certain that they spent more time with patients before, but we can presume that it's detracted from the patient experience. We have lots of anecdata about the fact that doctors can't make eye contact if they're at the keyboard, right? And so I'd say one of the most exciting things about AI is restoring humanism in medicine. The ability to take an AI recording, have it smartly transcribed, not just word for word, but actually put together an intelligent clinician note that saves the doctor that time at the keyboard, might even tee up orders, make them more efficient, and ultimately improves the patient experience because you're restoring humanism that we've taken away as we've tried to digitize and make care safer. And so, as I look at this arc over the last 20 or 25 years, I think it's really important to know AI doesn't work without the digital data to feed it. And yet, a lot of what we do to collect that digital data has made the whole process of being a patient more painful. And so, this is a really timely tool that allows us to actually restore that humanism in care, which is why we all went into medicine in the first place. And so that's probably the most adopted AI tool today. And to answer your question about, I think that what we're seeing is doctors going home earlier after clinic, spending less time after hours documenting on patients that they've cared for because the AI can help them complete that busy work. And that's what we want.
Yeah, that's super exciting. So it sounds like hopefully now patients can have a better experience and people like you will hopefully be able to use these tools to enjoy more of their work.
Let's hope so.
On the flip side, a lot of students, or even adults actually, are anxious about what AI means for their future jobs. When you look at healthcare through the eyes of a former chief digital officer and now an incoming CEO, how do you view the fear that AI is going to take all of our jobs? What do you think the balance between human work and AI will actually look like in healthcare?
First of all, I don't think that humans are going anywhere in healthcare, right? Both on the patient side and the caring side. And that's not just our bedside clinicians, that's lots of managers and leaders, the people who are figuring out how we can deliver the highest quality care. It's the researchers. All those people are going to continue to be needed. However, when we look at what's happened in healthcare over the last 50 years or so, since the 1970s, we see that healthcare has become increasingly expensive around the world and in the United States, right? It's now the leading industry in 42 of our 50 US states, and that was not the case just 30 years ago. It employs more people, it costs more. We've got to look for ways to be more efficient, especially as our population ages and we see more chronic disease burden. And so I'm really excited about AI to augment humans. I like to think about AI as augmented intelligence because I think it's going to allow us to continue delivering more care as we have more people needing care without having to add or recruit more people to the workforce. And so hopefully that makes sense.
Yeah, that's a great perspective. And I hope it can. How do you expect the AI to change the way care is delivered specifically over the next 2, 5, and 10 years?
Good questions. I think over the next 2 years, we'll see a lot of AI used in back office functions. So things like news cycle and administrative efficiencies, right? We're already seeing that today. I think over the next 5 years, we're going to see a lot more clinical uses. So, diagnostic accuracy, for example, if you ask a room full of people if they've experienced a delayed or misdiagnosis, or they have a friend or loved one who's experienced a misdiagnosis, usually 50% of the room will raise their hands. And so it's a preventable source of harm that occurs every day in our health systems across the country and the world, right? And so I'm really excited about AI not only listening to the doctor patient interactions and relationship to help with notes, but also helping with differential diagnoses and rare, difficult diagnosed diseases earlier than they would otherwise. And I think that AI holds a lot of promise for augmenting that. Look, 10 years out, I think it's really hard to predict because this technology is so novel. It has a potential to really revolutionize the way that we deliver healthcare. But healthcare is slow moving when it comes to change. And that's not just because it's a high risk industry, it's also because it's a highly regulated industry. And so, for us to really dramatically change the way that we deliver healthcare, we're going to have to change the way that we pay for healthcare and the way that we regulate healthcare. And so, that's going to require a lot of smart people thinking about how we reimburse, how Medicaid and Medicare works, and other kind of big picture policy kind of questions.
Yeah, it is good to note for students like me that will not likely change too much over the next decade due to those regulations.
Katie, I guarantee you that we'll still have veterinarians and doctors and others delivering healthcare in 10 years. I think that the environment of how they're doing it, how they're billing for it, how they're getting paid for it will change as quickly as health policy changes. And for the students, that's really important because it means that there's a lot of ways to help. You can go into engineering and software and you can help with healthcare. You can go into medical school or veterinary school and help with healthcare, nursing school, but you could also go into health policy. You can help with from a public policy and legislative standpoint at the state or federal level.
Yeah, that's why we're trying to do this podcast here so that students can start to realize all the different ways of approaching these fields. It's going to be truly fantastic, and hopefully, right, we can use these tools to make care much more rewarding on both the caregivers and patient side of this.
That's exactly right, Acadia. And I'm glad you mentioned the caregiver experience because not only can we restore the humanity for our patients by making more eye contact and ungluing our doctors, liberating them from the keyboards, right? But I think we can also improve the caregiver experience by ensuring that our doctors and nurses and other clinicians are spending more time doing what they love, which is healing patients and caring for patients, and less time with bureaucratic busy work.
Yeah. Changing up a little, I wanted to ask beyond being good with technology, what type of human skills or ways of thinking do you believe will be essential in healthcare by 2035, particularly ones that people might not even be thinking about right now?
Well, that's a great question. First of all, I think that medical school has traditionally taught us as individuals to care for other individuals, which is important, and I don't think that goes away. But increasingly, I think that systems thinking or systems design or systems engineering is a critical skill. So we need to think about how we care for populations and how we get the outcomes that we want to drive by setting up the processes, policies, and technology to get those outcomes. And so the more systems thinkers that we produce, the better. And so a lot of the new medical schools, including Kaiser School of Medicine and others, are investing in these systems design kind of courses so that we can design a better healthcare solution, design a better mousetrap moving forward. And again, the issue is there's a lot of well-intentioned people who, if you gave them a whiteboard, would design a great healthcare system, but then we have to be able to pay for it too. And so at the same time, we have to have systems thinkers on the legislative and policy side, thinking about how we use our limited resources to drive the best outcomes for the maximum number of people.
Yeah, indeed. That's a great point. I'm curious. Seattle Children's serves kids and teens from across a huge region. As you think about that future and where you're going, how do you imagine AI helping you reach and care for young people who live far away from the main hospital or in very different types of communities?
Yeah, thanks for bringing that up, Acadia. First of all, Seattle Children's mission is to deliver hope, care, and cures to as many children and families as we can. And most healthcare for children is not provided at a children's hospital, right? Most healthcare is delivered in the community by pediatricians, family practice physicians, mid-level providers like nurse practitioners and physician assistants, not only across the five-state region, but across the country, right? As I think about the future and how we want to impact care, we have to be in the community. And so partnering with those clinicians in the community is critical. And I think that Seattle Children's can help by delivering solutions that are optimized with AI or other technologies to help us best care for children in the community. And that might be delivering protocol based care to the majority of children, but also finding those hard to diagnose, difficult to catch rare diseases as early as possible. A lot of our healthcare systems today aren't optimized for those edge cases, those rare diseases, because the financial resources have gone into the common diseases that impact adults. And so we partner with our industry partners, with our researchers, and others to invest in solutions that help children.
I love that. Seattle's Children's described you as having a unique ability to merge the clinical operations, research, and digital strategy. For students who are drawn to both science and systems thinking, what did you notice about yourself that made that bridge role between medicine and technology such a great fit?
That's another great question, Acadia. And I guess if I were being introspective, what I might suggest is that it's a refusal to accept the status quo, constant curiosity and questioning of why can't we do things better or differently. Just not accepting that things have always been done the way they are, questioning dogma, questioning perhaps the most basic, most accepted things. For example, when we do physical exams on patients, we're taught, head to toe, everything to examine and what you might be able to find. But are they high yield? What part of the physical exam is most high yield? Could AI, based off of a history, help you focus on the most significant exam findings? And if it can, and if that works and it drives better outcomes, should we stop paying for doctors to record every aspect of the physical exam rather than focused or critical or salient portions? And that same kind of paradigm is true for lots and lots of things. The labs that we order, the genomic screening, the throughput, phenotypic analyses, et cetera. And so I think that we can design much better mousetraps if the average frontline clinicians aren't satisfied with the current mousetraps.
Indeed, right? Some of our biggest roles in the community is constantly asking the question, how can we make things better? How can we improve how things are currently to make care better, cheaper, faster? For our students who are curious about this field, what is a realistic, concrete action to start building these skills or mindsets now to prepare them for the future version of this career?
That's a great question too, Acadia. And I think that the first answer is that there's no single thing to do. I think it's really a matter of being curious and driven by curiosity to continue asking questions and learning more. So if you're interested, for example, in science and medicine, learn more about aspects of it. And I'll bet you that you can find ways to use AI to either learn faster, teach better, even make new discoveries, right? There's a lot of literature out there, and I'll bet there's a lot of connections between papers that have been published that haven't even been discovered yet. And yet AI can help with those types of things. Develop your own kind of AI agents that help you learn and start figuring out what it is that you want to learn about. Is it animals? Is it children? Is it adults? Is it elderly people? And how do you want to help moving forward? How do you want to leave an impact?
Yeah, I think that's a great point. How sometimes it's just as simple as exploring. I want to ask if you could send a message back to your student self about work and careers in a world that's being reshaped by AI. What is the single most important piece of advice you'd want to give that younger version of you to help them navigate the future?
Acadia, that's a challenging question, and I might give an unexpected answer. So, on the one hand, we always like to be skating where the puck goes. But I'll tell you, when you think about the arc of your entire career, which will be 30 or 40 years, it's really impossible to predict where things are going. And so, in that kind of context, what's more important is not thinking about what might make you more useful or give you the skills you'll need, because that might work for 3 years or 5 years, but we all have to be constant learners. We're all picking up new skills and new experiences all the time, right? I think what's much more important is being driven by that passion and curiosity. And so, as your high school counselor would say, I think the most important thing is choosing something that you love. Go into it for the right reasons, not because your parents tell you or because you think you might be interested, but explore it. And whatever it is that you love so much that you would do it for free, if you can figure out how to get paid to do that, then you'll be a happy camper your whole career.
I love that. Dr. Chris, thank you so much for sharing your time and perspectives with me today. And for everyone listening, remember the goal isn't to predict one perfect job, it's to build skills and curiosity that can grow as artificial intelligence and careers continue to evolve. And to help you visualize these changing landscapes and connect your interests to emerging opportunities, be sure to explore our AI in Healthcare Future Jobs Map and other resources linked in the show notes. This has been Paths of Curiosity in an AI world, exploring tomorrow's careers through the lens of AI. Join us next time as we continue mapping the future, one field at a time. Until then, stay curious.